Imagine a 5-year-old, not gleefully heading to school with her peers, but instead, weakened and vulnerable, confined to a small room, battling illnesses far too frequently. This is the stark reality for children like Samaya in Bangladesh, and it's a heartbreaking sign that something is deeply wrong with child nutrition. The latest data paints a disturbing picture. Despite some progress, child nutrition is stagnating, with persistent wasting and alarmingly low dietary diversity threatening the health and future of an entire generation. Sumaya's story, unfolding in Dhaka's Bagunbari slum, is a poignant illustration of this crisis. Her stunted growth and fragile body are silent testimonies to years of undernutrition and the daily struggle her family faces just to put basic food on the table. School, a dream for many children, remains an unimaginable luxury for Samaya. Rokhaya Begum, Samaya's mother and a domestic worker, painfully confessed that nutrition is a luxury they simply cannot afford. The skyrocketing prices of essential foods have made even managing rice and lentils a Herculean task. We struggle every day, she says, burdened by rent and the responsibility of feeding 3 children. Their meals predominantly consist of rice and vegetables. Meat or fish is a rare treat, and milk or fruit are almost entirely absent from their plates. And Samaya is not alone. The Bangladesh Multiple Indicator Cluster Survey, MICS, 2025, recently released by the Bangladesh Bureau of Statistics, BBS, reveals that many children across the nation are grappling with worsening nutrition challenges. Wasting, a condition where children are dangerously thin for their height, has surged to 12.5%, a significant jump from 9.8%, indicating a rapid escalation in acute malnutrition. The prevalence of underweight children remains stubbornly high at 23%. But here's where it gets controversial. One of the most concerning findings is that only 35% of children aged 6 to 23 months are receiving the minimum recommended variety of foods. This is critical, as dietary diversity is directly linked to healthy growth and a strong immune system. Why is it so hard to ensure children get the nutrients they need during these crucial early years? BBS defines wasting as a severe form of undernutrition, often triggered by rapid weight loss or a failure to gain weight. Children suffering from moderate or severe wasting face a drastically increased risk of death if they don't receive timely intervention. Stunting, characterized by impaired growth and development, stems from poor nutrition, recurrent infections, and a lack of adequate psychosocial stimulation. While the survey did highlight a positive trend, a decline in stunting to 24% nationally, the overall picture remains bleak. And this is the part most people miss. Even with the decline in stunting, nearly 1 in 4 Bangladeshi children under 5 are still underweight. This is a consequence of the combined effects of wasting, stunting, and persistent food insecurity, according to the BBS survey. The BBS has urgently called upon the government to intensify efforts in preventing and treating wasting, while simultaneously continuing its work to reduce stunting by strengthening food systems, improving primary healthcare, and enhancing water, sanitation, and hygiene wash interventions. Experts are warning of the long-term consequences if these issues aren't addressed immediately. Dr. Khaleda Islam, a professor at the Institute of Nutrition and Food Science, described the MICS findings as a mixed bag, a combination of progress and regression. Dietary diversity ensures access to different nutrients. Many children are not getting even 5 types of foods a day, she emphasized. Without dietary diversity, we cannot improve nutrition. Dr. Islam warned that the rise in wasting will inevitably hinder children from reaching their full physical and cognitive potential. A child who suffers from wasting cannot catch up properly. Their mental growth and IQ development will be affected, she cautioned. This isn't just about immediate health, it's about the future of these children and the nation as a whole. For the first time, this year's MICS included anemia testing, and the results were alarming. High rates of anemia were found among children aged 12 to 59 months and pregnant women, indicating widespread micronutrient deficiencies. We have long had iron deficiency anemia. Micronutrient-related anemia, including vitamin deficiencies, is very high, Dr. Islam explained. Maternal anemia increases the risk of low birth weight babies, who are more prone to pneumonia, diarrhea, and impaired growth. Both global and domestic economic pressures have pushed many nutritious foods beyond the reach of low-income families. Dr. Islam noted, people may eat enough to feel full, but they are not eating nutritious or diverse foods. She strongly urged authorities to incorporate the BBS findings into both public and private nutrition programs, placing a strong emphasis on improving food diversity. Professor Dr. Ferdowsi Begum, past president of the Obstetrical and Gynecological Society of Bangladesh, highlighted the critical need to address anemia before and during pregnancy. Maternal anemia increases the risk of postpartum hemorrhage and low birth weight babies. Low-weight newborns face higher risks of early death, she stated. Ensuring at least 4 antenatal checkups can help detect and treat these issues early on. If regular ANC is ensured, many problems can be prevented before they escalate, she added. The MICS 2025 data reveals significant regional disparities in child nutrition. Sylhet division has the poorest nutrition indicators, with stunting among children under 5 at 32% and wasting at 14%, both exceeding the national averages. In contrast, Khulna boasts the lowest stunting rate at 21%, while Dhaka has the lowest wasting rate at 11%. Nationally, only 74% of children aged 6 to 23 months receive the minimum recommended number of meals each day. Even fewer meet the dietary diversity standards, 35%, or minimum acceptable diet levels, 30%. Children from rural, low-income, and low-education households are significantly less likely to meet dietary standards. However, even in urban, wealthier, and more educated families, fewer than half of children receive adequate dietary diversity, indicating a widespread gap in nutritional awareness across the nation. This highlights that the issue isn't solely about poverty, it's also about education and access to information about proper nutrition. What steps should be taken to address the root causes of child malnutrition in Bangladesh? Is the government doing enough, or should more emphasis be placed on community-based interventions? And what role do you think international organizations should play in supporting these efforts? Share your thoughts and opinions in the comments below.